Hey mama, are you on the fence about whether an epidural is right for you and your baby during your birth experience? If you are wondering, what is an epidural? What are the pros and cons? Like, how am I going to make a good decision for my birth experience? In this video, we are going to be covering the pros and cons, or the benefits and risks that an epidural brings to the birth space. I'm Bridget, and I'm a doula in the San Francisco Bay Area, and I love helping moms love their birth. For more of my tips and tools on pregnancy, birth, and postpartum, make sure you subscribe to this channel and hit the little bell so you don't miss any of my other videos. So believe it or not, mama, but what makes your birth experience a positive one is not whether or not you've had an unmedicated birth, a vaginal birth, a C-section birth, whatever it looks like. What makes your experience a positive one is whether or not you have made informed and empowering decisions. So when you are making the decision of whether or not to get an epidural for your birth, which is a very common decision that women have to make during their birth process, you need to make sure that you know all of the things that comes with getting an epidural. So in this video, we are going to be talking about the benefits and risks, or the pros and the cons of getting an epidural. If you haven't already checked out my video on how to use your brain for decision making in birth, then make sure you check out this video, and it will help you get a really good and comprehensive idea on how to make decisions when you are in labor. So first of all, what is an epidural? So while most of us women have a pretty basic understanding of what an epidural is, it goes into a woman's spine, and then she doesn't have any of the sensations of birth or any of the painful sensations of birth. But I'm going to give you a little bit more of a technical rundown just so that you are a little bit more aware of what an epidural is. So an epidural is a type of anesthesia that blocks pain in a certain region of the body. When the anesthesiologist comes in to give you an epidural, they're usually going to have you hug your knees so that your spine is nice and rounded, and so it kind of opens up your spine so that they're able to insert the needle. And after they've inserted the needle into the lower part of your spine, they're going to thread a catheter, which when I say catheter, you're probably thinking a bladder catheter. But this catheter allows that anesthesia to be constantly feeding into that area so that it provides relief from those painful sensations of those contractions. So that's kind of a rundown of what an epidural is and how it is administered. So now let's talk about the benefits and the risks of getting an epidural. So the first and probably the most obvious benefit of getting an epidural is that, it eliminates pain for the most part. And so it can really help women have a positive birth experience if they are feeling like they've lost control, like they feel like they are experiencing suffering. Then having this epidural that relieves them of this pain is going to leave them with a positive birth experience. Another pro with an epidural is that it has been proven safe for mom and baby, which is a really big one when you are considering whether or not it's right for you and your baby during this birth experience. Another benefit with an epidural is that you are able to remain alert and present for your baby's birth. So sometimes with other medications, you're going to feel kind of dizzy or drowsy and kind of out of it for labor and delivery. And with an epidural, you are able to be fully present and aware of what's going on with baby. Another benefit that epidurals bring to the table is that it provides you and your partner an opportunity to rest during labor. Labor can sometimes be a lengthy process, and so sometimes it's not so much the discomforts and the challenges of labor that is causing you to get an epidural, but it's just being tired and feeling like you can't continue on with all that stamina. And so getting an epidural is going to allow you to rest, is going to allow your partner to rest, so that when you awake from that, you're able to give it your all with getting baby out of your womb and into this world. The last benefit that I want to mention when it comes to getting an epidural is that when a situation arises where maybe a C-section has to happen in order to keep you and baby safe, then an epidural is going to help provide pain management for that C-section. So sometimes in a true emergency where mom and baby's safety is time sensitive and mom maybe doesn't have an epidural already in place, sometimes they're going to have to put you under general anesthesia, which means that you are going to have to be unconscious for the procedure, which sometimes is, difficult because then you weren't really aware of baby being born, and then you're not really with it after baby is born. And so in those cases where, your safety and baby safety is time sensitive, having an epidural already in place is a huge benefit for you to be conscious while baby is being born, and also as a form of pain management. So before I hop into the risks or the cons of getting an epidural, I do want to mention that this list is a little bit longer than the pros, but I have to say that the pros or the benefits are like really big. So maybe the list is a little bit longer for the cons, but having a, pretty much painless birth towards the end is a huge thing. Having something set in place for, an emergency C-section is a huge thing. So epidurals bring big positives to the table, but they also can bring a list of risks that are involved when an epidural is brought into a birth. So now let's hop into the risks or the cons of getting an epidural for birth. So one of the biggest risks when it comes to epidurals is that when you get an epidural, you are not always just getting the epidural on its own. So what that means is that after you've gotten an epidural, often what follows is called this cascade of interventions, where because you've gotten an epidural, there are going to be things that follow that have to happen or take place because you have gotten that epidural. So maybe that's a procedure, or maybe that's other medication, or maybe that's IV fluids, whatever it is, it has to happen probably because an epidural was given during your birth. So some of the interventions that are commonly done after you've gotten an epidural is a catheter is going to be placed in your bladder because you don't have control over your bladder and peeing. They're going to have to do continual fetal monitoring because they need to have a close eye on how baby's doing and reacting to those contractions. And so if you've been wanting intermittent fetal monitoring, then that's not going to happen. They're going to have these straps across your belly so that they can keep a constant eye on how baby's doing. Oftentimes, after you've been given an epidural, your labor is going to slow a little bit, which means Pitocin is going to have to be given in order to keep those contractions progressing, getting more frequent and powerful enough to birth baby. And with that Pitocin, sometimes those contractions are going to become stronger, and so that's going to need to up the dosage of the epidural that you are getting. And so it's sometimes this little stairs where you have an epidural, then you need some Pitocin, and then you need a little bit more from your epidural, and then you need some more Pitocin. Maybe you need to take it down a little bit in your Pitocin. And so it's just kind of this staircase that you're going up with these interventions. So very often after mamas have gotten their epidural, they are going to have a drop in their blood pressure. And so what that means is that oftentimes they're going to have to be given oxygen. They're going to have to be given IV fluids to increase their blood volume. And they're really going to have to keep a close eye on mama's blood pressure by having her monitored and having her blood pressure taken through that cuff on her arm, and they're really going to need to keep a close eye on baby. The reason that they're going to have to keep a close eye on baby is because when mom's blood pressure drops, it can affect baby and cause their heart rate to decelerate as well. Again, that's when they're going to want to give you oxygen. They're going to want to give you those IV fluids. They're going to have you be changing positions to make sure that baby is getting, optimal oxygen to their brain and to their body. And so, like I was saying before, there's this cascade, this little waterfall of interventions that take place if you get an epidural. So another con with getting an epidural is that it can sometimes produce a fever. In fact, you are 5 times more likely to get a fever if you've gotten an epidural. And the reason why this is a risk factor with getting an epidural is that they don't know if the fever is from the epidural or if it is because of an infection in the amniotic fluid. And if that's the case, then they're going to have to administer antibiotics. And so if they see that you have started to spike a fever, then they're just going to administer those antibiotics just in case, because there's no way of knowing if there's an infection or if it's just from the epidural. So one of the big benefits of getting an epidural, like I had mentioned before, is that, of course, it gives you pretty much painlessness for labor. But this painlessness or this numbness can kind of work against you during that delivery stage of the baby where you are trying to push them out of your vaginal canal and into the world. So when a woman has gotten an epidural, she's really going to have to depend on her support system to help her know when to push, like when she's having that contraction, and how long to push. Because of that numbness from the epidural, it's just going to be harder for you to listen to your body to know when to push and how powerfully to push. And the risk in that is that sometimes you aren't going to be pushing as effectively, like with the contraction, or you're going to be pushing too hard and not knowing when to hold back to let baby, be stretching those tissues, which can cause tearing and just cause irritation or swelling. And so that's kind of where the risk comes in when you're not sure how to push during that delivery stage of the baby with an epidural. So another big con when it comes to an epidural is that there is no 100% guarantee that it's going to do what it promises to do. Sometimes women will get the epidural and it only works on one side, or it's not as powerful as they need it to be. And so they're having to deal with the discomforts of labor without having the mobility that they would like to have because they have an epidural and they're pretty much bound to the bed. So that brings us to the next con, which is once you've gotten the epidural, you are pretty much bound to your bed. Now, it depends sometimes on the anesthesiologist and what they are able to do. Sometimes they're able to give you like a lighter epidural so that you're able to, do things on the bed, but primarily they're going to want you to stay in bed because you don't have as good of control and function in your lower body. And so they want you to be safe, which means the best place for you to be is in bed. So since the epidural is pretty much going to have you spend most of your labor in bed, that also means that you're going to be most likely pushing on your back when it comes to that delivery stage of the birth process. And laying back is not an effective way to push. Baby's working against gravity when you're doing that. Your pelvis is not as open as it could be in other positions. And so when you're laying on your back, which you are pretty much forced to do when you have an epidural, you are not birthing in an optimal position. So the last thing that I want to mention is pretty big when you are weighing the benefits and risks to getting an epidural. And that is how it's going to affect your baby during and after birth. So any pain medications that you take into your body are going to pass through the placenta to the baby. Now, I said at the beginning that epidurals have been proven safe for mom and baby, and yes, that is true, but that doesn't mean that there aren't any side effects to using an epidural. So when mama's blood pressure drops, as it often does after getting an epidural, what happens to baby a lot of times is that it produces a non-reassuring heart rate. So sometimes it'll decelerate, which shows that baby's under stress and maybe will need a forceps vacuum delivery or will need an emergency C-section because it shows that baby is maybe not in the safest environment. So oftentimes too during birth, after mom's gotten an epidural, baby is more prone to be in a malposition. And sometimes that's because mama is laying on her back or not moving as much. And so baby isn't as easily able to engage into the pelvis and move around to where it needs to be in order to be in an optimal birthing position. Studies on babies who have gotten an epidural show that after birth, a lot of them have difficulty latching during that golden hour when babies want to latch. When they have an epidural, they're oftentimes more drowsy or just not quite aware and ready to latch, which can cause difficulty later in breastfeeding. An epidural can also cause baby to have respiratory issues after birth, where baby just has a little bit more of a difficult time breathing. And all of these issues are able to be resolved very quickly. And sometimes baby doesn't show any of these difficulties or these challenges after or during birth. But they are risks to consider when you are asking yourself whether or not an epidural is right for you and your baby. I hope this video has helped you understand how to weigh your options when it comes to getting an epidural or not, using your brain, the BR of brain, the benefits and risks, when determining whether or not an epidural is right for you. Mamas, if you've gotten to the end of this video and you're thinking to yourself, I do want an epidural for my birth, I've weighed the benefits and the risks, and I can tell that the benefits definitely outweigh the risks for my situation, then I want to say that you should be supported in your decisions, that I hope you feel empowered with the decision that you're making. You are making the one that is going to be best for you and your baby so that you can walk away from this experience with a positive birth memory. Some of you might have gotten to the end of this video though and thought, I don't actually want an epidural. I want to try for a natural, unmedicated birth, but you're not sure how to labor and cope with the challenges of labor in a natural, unmedicated way. And if that's the case, I'm going to be making a video for you how to have a natural, unmedicated birth. So make sure you stay tuned for that. Thank you so much, you guys, for watching this video. I hope you guys feel informed and empowered over the choices that you have for birth. Thanks for watching. I will see you in the next one. Bye, mamas.